With the advent of the BTK inhibitor Ibrutinib, the outlook for patients with relapsed refractory CLL and MCL certainly improved quite a bit. The drug is very active, and yet, particularly for high-risk patients, and for CLL, that means especially patients with TP53 dysfunction, the durability of these responses is usually relatively short. So in that CLL high-risk population, looking at a median progression-free survival of only about 2 to 3 years in the relapse setting with Ibrutinib as a monotherapy. And in mantle cell lymphoma, even though the response rates are high, actually the progression-free survival is only a little over 1 year with Ibrutinib as a monotherapy. So certainly that provided a rationale to try to develop combination approaches for this population, and there's a number of them that are being evaluated right now. The one that we focused on was looking at dual blockade of the B-cell receptor pathway. So we know that the CLL cells and mantle cells depend heavily on this B-cell receptor pathway for survival, and that there's actually another arm of the pathway that has PI3 kinase as a key node. And so we were really interested in going after this other arm of the pathway to see if we could try to prevent resistance to Ibrutinib as a monotherapy agent. And that was really the rationale for the study design.